U.S. maternal death rates are at the highest in nearly 60 years, according to the CDC. And the most vulnerable group are Black women, who are more likely than any other racial or ethnic group to die of pregnancy-related causes. To bring awareness to this issue, President Biden officially proclaimed April 11th through the 17th as Black Maternal Health Week. The U.S. Department of Health and Human Services is also springing into action by promising comprehensive and continuous maternal health insurance coverage during pregnancy. And lawmakers are pushing for more equity in health care overall. Joining me now is Illinois Congresswoman Robin Kelly, member of the Energy and Commerce Healthcare Subcommittee and the chair of the Congressional Black Caucus Healthcare Brain Trust. Congresswoman, thank you so much for joining us. This is a really important issue, and the numbers really lend credence to that. A 2021 CDC report revealed that the maternal death rate for Black women spiked more than 25% to almost 70 deaths per 100,000 live births. And although fewer Black women gave birth that year, they still died at higher rates. Red states like Arkansas top the list of having higher maternal death rates. That's not a coincidence, is it, Congresswoman?
No, it certainly is not. And thank you for highlighting these unfortunate statistics. No, it's not. Is not surprising, but also I led the fight to have the postpartum care coverage by Medicaid to extend to a year. And I'm proud to say first that Illinois was first to do that, but then there's many other states. I think we're at 32 states now, with other states coming on board. And some of those states are the more red states where these deaths occur more often. So there's hope.
So we are, though, living in a post-Roe world where right now abortion medication is not easily accessible and abortion procedures are banned in some states, and mortality rates are climbing nearly 40% since the pandemic. How does this affect Black women's maternal mortality rates?
Oh, there will certainly be more deaths if you're forcing women to have babies that they don't want to have. So that's what we expect, that there'll be more deaths because of this unfortunate ruling.
So Black Maternal Health Week is part of a long legacy of Black women-led reproductive justice advocacy and organizations. So how are lawmakers working with these particular organizations to ensure that the issues are being heard and that the changes are being made?
I'm leading a bill called the Mamas Act, and we didn't make a move without consulting with these Black organizations, without consulting with ACOG, without consulting with women who have been through this or know someone that has been through it. You know, everybody didn't die, but they still had to go through this when they had a baby. So we've consulted with them, and that's why we put together. There needs to be, national protocol. There needs to be culturally competent training. There needs to be review committees and things like that. And again, we need to extend the postpartum period permanently and mandated through all 50 states. But we got these ideas from them, enhancing or raising the awareness of doulas and midwives. It's all a part of my bill and other bills that are in Congress also.
So not all states and communities are created equal. Rural maternal health care, right? Let's emphasize that. Rural maternal health care, it's vanishing, and it's putting more Black women at risk. So what are lawmakers doing in response to this?
Well, last Congress, I went to bat to ask for more money in appropriations, which happened for rural obstetrics. And we really need to open up what the options are. I just spoke to some women the other day, and some people can have babies in hospitals, but there needs to be birthing centers or, having babies at home. We need to open up those options, and again, enhancing midwifery, doulas, and other professions.
So an overwhelming majority, Congresswoman, of maternal deaths are preventable. The CDC found that more than 80%, or roughly 4 in 5 maternal deaths, were due to preventable causes. Researchers studied in 2017 to 2019 deaths, which Black women made up a disproportionate, 1/3 amount, and that they're more likely to die of cardiac and coronary problems. So what can be done to help prevent these deaths on a nationwide level?
Well, first of all, you have to attribute some to racism. That's just the bottom line, because you can be Black, wealthy, well-educated, in great shape, and you still die at a disproportionate rate compared to white women that have graduated from education. So we have to have culturally competent care. That is the bottom line. And then also access to care, period. Black women don't have the same access to care as their white counterparts, whether you live in rural areas or urban areas or suburban areas. And then hospitals are closing in these areas also. So we have to provide, places for women to go, quality places for women to go.